Congratulations on your decision to have a colonoscopy exam. I'm Dr. Amy Patrick and am board certified in gastroenterology. I've been doing colonoscopies for more than 20 years and am going to tell you more about your procedure. I'll walk you through the risks and benefits and give you the information you need to give a fully informed consent for the procedure. Colonoscopy is a safe and effective test not only for diagnosing and treating many conditions, including pain, bleeding, and diarrhea, but also for the screening and prevention of colorectal cancer. Colon cancer is the most preventable of the deadly cancers. Unfortunately, only about 50% of patients who should be screened are screened. This lack of screening leads to tens of thousands of deaths from colon cancer in the United States each year. Your decision to have a colonoscopy will help reduce your risk. Despite its reputation, having a colonoscopy is not as difficult as it used to be. Most people say that the worst part is the required bowel preparation, which cleans you out and allows your doctor to visualize the lining of your colon. Fortunately, today's bowel preps are easier than those in the past. Your doctor will provide you the instructions for your colonoscopy prep and exam separately. You should review and follow those instructions carefully, as a clean colon allows for a high-quality exam. Upon your arrival at the colonoscopy center, a nurse will ask you some brief questions about your medical history. Then you will change into a patient gown and your clothing and personal items will be secured. The nurse will then place an intravenous line in your arm or hand. Next, a nurse or doctor from the anesthesia department will speak with you and explain the type of sedation that you will be given. Your sedation will be individualized to your needs. The most common drugs used for a colonoscopy are propofol, Versed, and fentanyl. The anesthesia provider will answer any questions you may have and will explain the risks of sedation. When your GI doctor is ready for you, you will move to the colonoscopy exam room. Routine monitors will be applied. Your sedation will be started and you will fall asleep before your doctor begins your colonoscopy. Your doctor will insert the colonoscope, which is a flexible tube with a light on the end, into the rectum. The colonoscope is advanced the entire length of the colon, which is about 6 feet. During the study, your doctor may need to take a biopsy or remove a polyp or growth so that tissue can be examined under a microscope. Sometimes tissue is removed with a simple forceps instrument, and at other times, electrocautery must be used. The entire procedure usually takes about 30 minutes, but procedure times vary for each patient. When your exam is finished, you will be transferred to the recovery area, where you will wake up. In this area, your nurse will ask you to expel any air retained in the bowel from the procedure. Passing this gas tends to alleviate any cramping that you may have. When you are awake and feeling well, you'll be given something to drink and your driver will be asked to come to your bedside. Your GI doctor will speak with you about exam findings before you leave the center. Your nurse will give you written and verbal discharge instructions. Once you leave the center, you may not drive a vehicle, operate machinery, or make important decisions until the following day when your sedation has completely left your system. Let's move on and talk about the risks of colonoscopy. Colonoscopy is a very safe exam with low complication rates. However, the chance of a complication is not zero, even in the best of hands. And it is very important that you understand the potential complications related to colonoscopy. Most complications of colonoscopy are minor and resolve quickly without treatment. These minor complications include skin IV site soreness and inflammation, abdominal bloating, gas and discomfort, nausea, rectal irritation, and minor bleeding. More rarely, a significant complication may occur. Significant complications include serious intestinal bleeding, often related to a polyp removal. This problem may require a repeat colonoscopy to stop the bleeding, blood transfusions, or even surgery. The chance of this complication is less than 1 in 100. A colon tear or perforation. A perforation can require hospitalization, IV antibiotics, and/or surgery to repair. Colon perforation occurs once in approximately 2,000 colonoscopies. Aspiration. Aspiration is an infection caused by stomach contents being inhaled into the lungs during the procedure. Reaction to a medication. Heart attack, heart rhythm abnormality, a breathing problem, or respiratory arrest or seizure. Please note that while rare, these significant complications may occur even in the hands of the most careful, experienced doctor and staff who have done the procedure correctly. They can occur without warning, be life-threatening, and result in surgery, hospitalization, or even death. Test accuracy. Finally, you need to know that colonoscopy is not a perfect test. Studies show that even in the hands of the most careful, experienced doctor, as many as 10% of important findings may be missed during a colonoscopy. Missed findings may include precancerous polyps, cancers, and other abnormalities. You can help lower the risk of missed findings by strictly following all of your prep instructions to ensure a clean colon. Although your healthcare team is dedicated to providing the safest, most effective colonoscopy, they can make no guarantees about the positive outcomes of this procedure or its findings. Alternatives to colonoscopy. You need to be aware that there are alternatives to receiving a colonoscopy. Though not appropriate for all patients, other potential options include virtual colonoscopy, flexible sigmoidoscopy, barium enema, stool sampling tests, open surgical procedure, doing nothing, not performing any test at all. All of these alternatives carry their own set of risks and limitations. For many patients, colonoscopy is the best option. Please ask your doctor if you are concerned that another test may be better for you. Miscellaneous issues. You must also be aware of and consent to several miscellaneous issues. Medicine is not an exact science. No guarantees have been made to you concerning the results of this procedure. Furthermore, it is impossible to inform you of every possible complication that could occur. There may be the need for an unanticipated change or extension of your procedure, depending on the findings and result. You consent to this extension as determined by the medical judgment of your physician. You consent to photographs being taken and non-identifying information published for scientific or educational purposes. You also consent to the admission of observers to the exam room as approved by your physician for technical or educational purposes. You consent to the retention or disposal of any tissue which may be removed during the procedure. If any member of the center's staff is exposed to one of your blood or body fluids during the procedure, you consent to the testing of your blood for HIV and hepatitis at no cost to you. Be aware that the center does not honor any advance directives. In rare situations, another qualified physician endoscopist other than your doctor must be involved in or take over your procedure. That's it. We wish you the best of luck with your procedure and good health in the future. Please check the boxes only if you have heard, fully understand, and consent to all the issues in each section.